My name is Amanda Stokes, and I currently work for Kidney Care. I am the front office manager. I make sure the building is stay intact. I work directly with my patients with information, making sure they get to dialysis to and from. I help schedule appointments for patients that have to get their CVCs out. I make sure everybody gets to where they need to go. I deal with doctors every day. Um, I encourage my patients to do their dialysis on a daily basis because a lot of times patients get to where they don't want to come to dialysis. And we make phone calls if they don't show up. We encourage them to come because they have a lot of problems if they don't come. They end up in the hospital. They are sick. They have a lot of different illnesses. And we encourage everybody to come to dialysis because it's a lot of factors that happens when they don't come. You know, fluid buildup, all because of the toxins building up. So we encourage them. So if you have anybody that do dialysis and they don't want to come, just kind of encourage them to go. Have them to talk to the AAs in these clinics if they're having transportation issues, because that's part of their job. Encourage them to talk to the social workers to help them. They have the Kidney Foundation that helps them with, they can get a voucher for transportation through the Kidney Foundation every 3 months. They can get they can help with food. They have different programs. If you do the Kidney Foundation is the Kidney Foundation and the Kidney Fund. And they can help you they fill out these forms every month. And if you can do it like every 3 months, some of them give you gas cards. Some of them help you get food. They give you vouchers for that, maybe 100, anywhere from 50 to 100. It just depends on their funding. Every dialysis clinic company should have an insurance coordinator. And they should be able to help you with getting the insurance information that you need. The only thing I can tell you that I know for sure, you will get a bill from the different companies, and they will tell you, call the company, talk to them about your bills, and then they'll tell you if you have Medicaid. A lot of times they tell you to bring in the bills or have the bills faxed in, and it's supposed to help lower the payments, and they'll take care of the bills once it reaches a certain limit. Or you call an insurance company, because there's a lot of insurance companies on the TVs and everything, and they can tell you if they cover dialysis, which a lot of them do. It's just a matter of following through to make sure you get everything that you need. Yeah, they're supposed to help with transportation. The AA, if he has Medicaid, if he has the Medicaid program on his insurance, or they can do JTA, which they fill out a form for you, help you fill out the form. They give you the form, you fill it out, turn it back into them. They send it in, they send it to JTA. They have the JTA connection, can come to your home, pick them up directly. It may cost you anywhere from $300 to $350 per trip to and from. And then you can go to JA, set up an appointment. I do a lot for my patients. I make sure if they have to go other places, I help them get an appointment with JTA to be certified to be able to go to any doctor's appointments, go to the grocery store, go anywhere they need to go. That's what AAs and some social workers do. I cover a lot of things social workers supposed to do. I do it because those are my patients. You know, I look out for my patients, even them calling me on my own phone, because I care about my patients. Yeah. And I tell anybody that has that, use it wisely. Either go to the doctor or you go to dialysis. Don't just use it to go to the store. Don't use it just to go anywhere else. Use it wisely, because those 72 rides, 2 a day, 3 times a week, they go just like that. And they do not give you any more. So get an application from JTA, get it filled out. For the first 30 days, you have to call and set up your rides. And after that, she can do a standing order for you. And once the standing order is in place, maybe for about a week, you have to call and make sure it's set up. And after that, they should show up automatically. Yeah. So that's what I do. I brought some handouts and things that you all can read about transplants and just dialysis in general to kind of give you some ideas of things. And it has questions, it has organizations on it to help with raising money if you want to do, because there is a certain way that money has to be raised for transplants, and they will tell you what you can and cannot do. Even if you went through different hospitals, they'll tell you what you can and cannot do and how you raise your money. So I brought that information for you all to get. And it's just other information about dialysis in general. I forgot to mention, I'm here because Shirley and Miss Rose supported me, my husband's heart transplant. And he had that in September. So I know how important it is to be an organ donor. I've signed up to do it. I think my husband is, and I'm getting some of my other family members eventually to do it as well. So thank you all for help supporting me. Even though it wasn't kidney, it was heart. I appreciate it. Me and my daughter both appreciate it.